This afternoon, I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director, and also a pleasure to welcome Dr. Tammy Packer, the Chief of the Department of Family Medicine at Hamilton Health Sciences and at St. Joseph's Healthcare, and Dr. Skylar Neblett, Associate Lead of Ancaster Family Health Organization, Dr. Mehul Patel, Family Physician, Associate Lead of Southmount Family Health Organization in Stony Creek, and Dr. Mike West, the lead physician, first physicians of Dundas Family Health Organization, all of whom have joined us today to talk about vaccine hesitancy and vaccine confidence, speaking from their experience working in their practices across the city and in COVID-19 vaccine clinics over the past few months. So as you know, we remain under a province-wide state of emergency, stay-at-home order until at least May the 20th. It's anticipated that it likely will go on longer. There's certainly a strong possibility of that. And as the situation across the province remains serious, with ICUs continuing to be quite full and COVID-19 cases still higher than we would like to see, including variants of concern, the restrictions we have in place continue to be required to help reduce the spread of this virus. So as a reminder, under the stay-at-home order, please continue to remain at home except for essential reasons such as going to the grocery store or pharmacy, accessing healthcare services, including getting vaccinated, or exercising outdoors, or for work that cannot be done remotely. Please stay local, avoid all non-essential travel, even within the province, and stay home when you're ill, even with mild symptoms. So again, thank you to everyone who continues to do their part by following our public health measures. You are making a difference. Please visit hamilton.ca/coronavirus for a fulsome list of restrictions under the stay-at-home order. And I'd also like to recognize that this week is National Nursing Week. I'd like to take this opportunity to express my sincere thanks to all nurses working in hospitals and primary care, public health, long-term care, and community settings. This past year has been particularly challenging, and your dedication to protecting the health of Hamilton residents is inspiring. As the Mayor and Chair of Board of Health, I'd like to specifically thank our nursing staff in public health services and in the city's two long-term care facilities, Macassa Lodge and Wentworth Lodge. So throughout 2020 and 2021, our nurses in public health have been conducting case and contact management for individuals, schools, and workplaces, administering vaccines, and providing essential services. Our nursing staff in long-term care provide excellent care for our senior residents and continue to adapt to the health and safety requirements of the pandemic. So once again, thank you to all of our nurses out there. You have definitely answered the call during this pandemic and always. I'm now going to pass it on to our Emergency Operations Center Director, Paul Johnson, for some local details on what's open, closed, and otherwise. Paul.
Thanks very much, Mr. Mayor. And I just want to pick up where you left off and also celebrate and give my best wishes to the nurses in this community. You know, I'm blessed that our leadership team within the Healthy and Safe Communities Department here at the City of Hamilton to have two nurses that are on our leadership team. The first is Holly O'Duarty, who is our Senior Administrator of Macassa Lodge and also helps support the work at Wentworth Lodge. And then the other is our Chief Nursing Officer, Jen Vickers-Manson. And so to have their expertise and specialty at the table and to know just the work that they put in and doing the jobs that they're attending to, as well as being leaders and mentors and role models for nurses is great. And I would be remiss if I didn't thank all of the nurses that are involved in all of our partner organizations who help the City of Hamilton deliver services each and every day. We're proud of all the nurses that work here at the City of Hamilton. It's great that we're able to connect with so many organizations who also employ nurses to help us not only through this pandemic, but they're there providing services each and every day. I do want to say welcome to our guests as well. It's fantastic to have family physicians and the work of primary care being discussed today and having your presence here. And to Dr. Packer, who I just call Tammy, and she just calls me Paul. I do want to say a special word of thanks. Throughout the pandemic, you and I have crossed paths, unfortunately, in some of the most desperate situations in the early part of the pandemic. And your leadership was one of the reasons that we've been able to take the best actions possible. So thank you to you and to all of your colleagues. And thanks for being here today. You know, we are in the midst of the stay-at-home order with basically most things in this community shuttered or having very limited access. We are thinking towards those days when things will become a little less restrictive. And in particular, when we hope people will be able to get outdoors more and be engaged in some programming that is more recreation-based in our community. And to that end, I wanted to start today with updating folks on recreation and reminding people that we are planning for a very fulsome summer of activities. And I get right now we're in a stay-at-home order, and I'm often the one that's saying, you know, make sure we respect it. And I still will say that, respect the stay-at-home order till it's lifted. But as we look forward into July and the tail end of June, we are preparing ourselves to be ready for that moment when we can be a little less restrictive in this community. So I wanted to remind the community that our Camp Kadaka registration is open. Many people have signed up already. So take that opportunity. If you want to look at opportunities for your children, that programming starts on July the 5th. And that also includes our one-to-one inclusion program. So lots of opportunities for children to be engaged in activities. We're readying our pools. We want to be ready for June the 28th to reopen our pools, both indoor and outdoor, as well as the wading pool in Dundas. And the outdoor pools would actually be available on Canada Day if they can be open. We want to have our park programming and free fitness in the park and the 112th year of our SUPI program ready to start on July 5th. We want to make sure our outdoor assets, including our sports fields and our diamonds and our golf courses, are ready to go when the province says that we can open those facilities. And our spray pads, the same way. We want them to be ready to go for when that word is there. And so I mentioned that today to say that we are having a bit of optimism within our department. The city is looking at how we ready facilities to be there for when the time is right. The time is not now. The time is not today, and the time is not next week. But we are looking forward to the opportunity when we can be there. And unlike last year, where we were being very conservative and shutting things down and canceling things very early on, this year we are going to be very optimistic, and we're only going to cancel things as necessary by provincial order or by our local public health folks saying that they can't go ahead. But we're readying ourselves for a good summer of great outdoor activities, both sports and recreation and all the good camp activities that people like to see. So that's the positive side and the optimistic side. Just a reminder to the community, though, that we're not there. And we still are seeing a large number of residential gatherings, parties, events being hosted by people, despite the fact that gatherings, both outdoor and indoor, without outside of people within your own household, are prohibited, with the one exception that single people can join an exclusive other household during this particular time. So we continue to be out with our bylaw officers and Hamilton Police Services when necessary, ticketing and laying charges for those types of activities. We also have been having protests regularly in our community, and that's unfortunate, but our bylaw officers work with Hamilton Police Services. They lay charges. And as I've mentioned in the past, not only do they lay charges on the day, they also review the information that they collect, and they also can provide some charges later on. So some people say it doesn't sound like a lot of charges, 25, 30, 100 people at the protest, and only 5 or 6 tickets given out. Sometimes we need to investigate, and we are really focused on making sure that the organizers of these events are found and that charges are laid appropriately. There are a few businesses in our community where there are ongoing pieces of work happening with our municipal law enforcement folks, particularly working with the province and the Ministry of the Attorney General around a couple of tattoo parlors that continue to operate despite the fact that they've received charges and they should be closed. And also in one case have had their business license suspended. There's also a gym, Fresh Fit Athletic, where we're doing some further investigation. I know the community has been asking some questions about that. No charges have been issued in that case yet, but we continue to investigate there. And we did have a private school in Ancaster that was operating without approval from the Minister of Health. And therefore, because they could not provide any documentation to suggest why they were open, there were charges laid in that case as well. So it's an indication that we still take this stay-at-home order very seriously. So should you. It is having some of the effect we wanted it to. And when you hear from Dr. Richardson in just a second, in terms of where our numbers are and the cresting and even the slight drop in some of the numbers, we're doing the right things. The challenge is we're really high still. So we want those to come down to a much lower level, which will allow us to do some more of the fun announcements, like when exactly we're going to be having pools and sports fields and other things open to the public more for their use. So please stay the course. Recognize that we'll be able to enforce when we need to. Do not call 911 for that kind of enforcement. Enforcement under the stay-at-home should really just be a phone call to the city, and we'll have our bylaw folks attend as they need to. Dr. Richardson, over to you.
Thanks very much, Paul. And I want to join you in acknowledging Nursing Week. This year's Nursing Week theme is We Answer the Call. And it's a testament to the incredible work that nurses are doing, working in partnership right across our health sector. As part of a multidisciplinary public health team, our nursing workforce in public health has been instrumental in protecting the health of our community by managing cases and contacts, by giving out vaccines, and continuing to provide the essential services that are needed for our most vulnerable people. The work we do requires a strong interprofessional workforce, and Nursing Week gives us an opportunity to acknowledge the significant contribution that nurses make to our community. Thank you to everyone who is part of our nursing staff at PHS and in Macassa and Wentworth Lodges. Thank you to all the nurses across the health system for your ongoing commitment to the health and well-being of our community. And I too want to welcome our guests. It's fantastic to have you all here with us. The tremendous work that primary care is doing in the pandemic response, whether it's running testing and assessment centers or being with us side by side in those vaccination clinics, and continuing, of course, to provide the care that you do in our community and long-term care homes and many other settings as well. And Tammy, to you as well, very much my thanks. As Paul said, your leadership, your caring, your compassion has truly made a difference in the community and in our response. Thank you. So by the numbers today, we're at 18,613 cases total reported, 101 cases increased from yesterday. We continue to see a number of variant cases, as you know, with by far the majority of the variants being the B117 variant, but we do have P1 variants and B1351 variants here, and just about 70%, 71% of our cases do have a mutation or variant of concern when we look at the cases in the last 7 days. We're sitting at about 1,124 active cases here in Hamilton. So by far, of course, the majority resolved, but many, many active cases that are still out there today. We sit at 369 deaths so far, and no new deaths reported today, but of course we continue to be concerned as we sit with those high numbers and know the impacts that we're seeing in our hospitals, seeing in the ICUs, that there may still be some deaths, of course, ahead of us. We're currently reporting a total of 44 local outbreaks on our website, 3 new ones today. So we still sit at a fair number of outbreaks, as you know. So the 3 new ones, Hamilton Wentworth Detention Center, Green Collar Landscaping, and Tim Hortons at 200 Barton Street East. Our 7-day moving average for cases is at 139, and that key indicator of weekly incidents per 100,000 is sitting at 163. So it's been sitting about the 180 mark the last couple of weeks, but still sitting well up there at 163. And our weekly reproductive rate has actually gone back up to 1.12. There's more details, as always, about COVID-19 activity on our dashboard. And I did just want to give you a little bit of an update about that lab issue that I mentioned last week in the process of moving results from the lab system into the province's case and contact management system. We have been working with the Ministry of Health to identify and resolve the cause. And as of today, nearly all the cases are being uploaded, and there's very little or no underreporting or undercounting or delay in reporting that is going on. So it's not fully resolved quite yet, but we're almost there. With that said, we still encourage you to look at the 7-day moving average in cases or the weekly rates rather than looking at the day-to-day numbers. On the vaccine front, as of today, we've locally administered 217,677 vaccines, and that brings us to 42% of the eligible population in Hamilton who have received a vaccination. As always, when we talk about our vaccination rates going up, I do want to stress how important it is that even for those who have received a vaccine, that they continue to follow public health measures until you hear from us that we no longer need to do so. And these measures are, of course, critical to protecting both yourself, your loved ones, and the broader community. So again, staying home as much as possible, and absolutely staying home if you're not feeling well, getting tested if you have any symptoms that are suggestive of COVID-19 or have been in close contact with a confirmed case of COVID-19, limiting gatherings to only members of your household, maintaining that physical distance of at least 6 feet or 2 meters, and wearing a mask, whether indoors at all times or outdoors if you're unable to maintain physical distancing. So we do continue to see a stable and reliable vaccine supply locally. As you know, the province had shared a much anticipated schedule for expanding up the age bands and other populations a couple of weeks ago. And the province is continuing to look at the timelines as they go through to see how many vaccine appointments are available and make specific announcements about moving through those stages. Just a reminder as well that as we go through, this is the time at which people will be able to book, are eligible to go online and book their vaccine. It does take some time to actually get a vaccine appointment from that date. So earlier today, the province announced that beginning May 11th at 8 a.m., so that's tomorrow morning, individuals with at-risk health conditions such as dementia, diabetes, and sickle cell disease, as well as Hamiltonians who are in group 2 of those who cannot work from home, which means all the frontline workers who are employed at local grocery stores, restaurants, transportation workers, and many more, are going to be eligible to book an appointment for the vaccine through the province's online booking tool. Starting later this week on Thursday, May 13th, those who are 40 years of age and over in 2021 will also be eligible to book an appointment to get the vaccine through the online booking tool. Please do use that online tool. It is the best, simplest, most available way for you to book in to get a vaccine. For those who absolutely can't use that, there is the hotline available to you, and that should really be reserved for those who do not have a computer, those who do not have access to the internet, and those who don't have a Green Ontario Photo Health card. In line with provincial direction, our high-risk healthcare workers and dialysis patients are also being added to the list of those eligible for receiving their second dose on a shorter time interval. This is because these individuals face a greater risk of contacting and suffering severe illness from COVID-19. Again, in this case, eligibility will be discussed further on later this week, and booking details come later in the week, but we don't yet have that. So if people can just hold off waiting to hear the specific news in terms of when that might be available to people, that would be great. We don't have any additional news or any additional access through our hotline. The AstraZeneca vaccination clinics that are being operated by our Hamilton primary care partners at David Braley Health Sciences Centre continue on this week until Thursday, May 13th for community members who are 40 years of age and older. And so you can call into our hotline to book into those clinics. We're supporting our primary care partners to provide those clinics. And there is also a walk-in option as well. Proof of age does need to be shown because this is a vaccination that is just being provided to those over 40. Local community health centers, community groups, and members of our Vaccine Readiness Network are also working with us to book and promote vaccination clinics for Black and racialized populations and people of color. This is the case for the vaccination clinic that is being planned this week with at the Hamilton Mountain Mosque, as well as the Hamilton Downtown Mosque. And we're very grateful for these organizations providing the support and helping to reach those who are at risk and help them get to the vaccination clinics. Information for community members on local vaccine clinic locations, all of them, both large-scale primary care and the mobile pop-up clinics, are all listed on our city's webpage at hamilton.ca /vaccine booking. And I encourage everybody to go on that webpage and become familiar where those vaccine clinics are being held. And as soon as you're able to receive a vaccine, you're eligible to get booked in, then go online and get an appointment for yourself. This is a key method, of course, for protecting not only yourself, but again, your loved ones and the community. Just a general update in terms of our case activity. It does continue, as I said earlier, to be high and includes a high level of cases that have screened positive for variants, and our local ICUs do continue to be challenged in terms of the number of COVID patients that are in the ICUs. We have not had outbreaks in non-congregate settings before, and such as a private apartment building, and you know that this is something we have been looking at since earlier last week. So we declared the outbreak at Rebecca Towers at 235 Rebecca Street, And we've been investigating some clusters of cases that we saw over the weekend in 2 other apartment complexes. So on May 9th, we were made aware of a cluster of COVID-19 positive individuals at the Village Apartments at 151 Queen Street North, as well as Wellington Place Apartments at 125 Wellington Street. And so we did declare these as outbreaks and have been, as I said, investigating this morning. Investigating these further. This morning, we were able to contact the landlords and ask them to notify all units, and notices were being delivered by the landlords today to those apartment buildings. So what we have found is that there's 18 cases across 7 units of the 360 unit building at 151 Wellington. And those cases have spanned from April 17th to May 18th. And just, it's important to realize that, of course, there will be some cases that occur in such a large building at any time. And it's when they build up to such a level that you start to be concerned about, is there some other reason for transmission occurring? And then we would go and investigate. And that's exactly what's going on right now. At 151 Queen Street North, there are 29 cases across 15 units of that 250 unit building, with most of those cases happening from April 20th to May 4th. We have been able to identify that there's household spread within the units. And so we know, of course, that's particularly where risk is higher when people are living together, of course, and sharing the kitchen, sharing the space there. And of course, often parents caring for children or for one another. But we've not yet identified any links between the units in terms of what we're seeing. So just flagging that there are higher case rates there, and we are looking into those further. So for all 3 of those, we are offering on-site testing for residents who want to avail themselves of that to identify and isolate as many cases as possible, and to further minimize any spread that might occur within those buildings, as well as across the community more broadly. Additionally, we're working with property management in all of those sites to identify any factors that contribute to the spread of the virus within the apartment complex. And while we appreciate, of course, this is a concern for residents, I want to really be sure to underscore how vital it is, no matter what sort of setting that you're working in. And even if you've been vaccinated, it's very important to maintain your vigilance when it comes to following those measures that I mentioned earlier. Avoiding close contact with anybody who is from outside of your household, wearing a mask or face covering when you're in any enclosed public space, the hallways, the lobbies, the laundry rooms, and if you're outdoors and unable to physically distance. So coming and going from the building or any other times when you might be doing that. So with that, I'm going to hand it over to our family medicine guests, and they're going to share with us some more information about what they encounter in their respective practices. And just are very glad that you all took the time to come and do that with us today. So over to you, Dr. Packer.
Thank you very much, Dr. Richardson, Mayor Eisenberger, and my friend Paul. I think it means a tremendous amount to Mehul, Skylar, Mike, and myself to be here today and to have the opportunity to reach out to beyond our conventional patient networks. I want to thank Paul and Dr. Richardson for allowing me my baptism by fire that sprung into action late last March, both in municipal politics and public health. It's been quite a rocky road, and I think you've just taken a lot of us under your respective wings, and we've all grown accordingly. So thank you for that open acceptance and tutelage along the way. I also want to call out Jen Vickers-Manzin and Holly Odwardy, who I've come to know, and I think that it's rare that I go more than 48 hours without speaking to one or both of them. And I think this really speaks to what's been our COVID journey. Paul, you've given us all a bit of hope hearing about summer fitness, summer pools. I hadn't allowed that into my inner sanctum, so thanks for giving us a little bit of hope. Our family physicians who are here with you today have each played a very significant role in our city's COVID response. Each of us have taken on a variety of care-related activities that have taken us well beyond what we would have considered our pre-COVID spectrum of care. COVID has given family docs a very unique opportunity to connect with the community in ways that address the care of our population as a city, rather than simply the patients we've known so very well in our individual and small community practices. Family docs at this point continue to staff our COVID assessment centers that are running 7 days a week, support our many congregate settings, including many long-term care homes, retirement homes, and residential care facilities. We're involved in outbreaks as we speak. Many are actively involved in working with shelter health and those who are inadequately housed. And yes, in addition to all of these important population-based aspects of care, we continue to support our patients at the individual level at both Hamilton Health Sciences and St. Joseph's, as well as, most importantly, within our own individual citywide family practices. Our city's COVID vaccination efforts have been Herculean, and we have more than 200 family physicians staffing the pop-ups, large sites, and family practice-led vaccine clinics that run daily. Our perspectives on the impact of vaccination on both the individual and the community come from lived experience, as you will hear from Mehul, Skylar, and Mike. COVID has enabled healthcare providers to work alongside our incredible public health partners, the city, and our community service agencies in ways that we've never before imagined or experienced. We're excited to use these learnings and these strengthened relationships to grow healthcare for our city's population. There's a whole lot of care that's been to some extent put on hold during COVID. We're very much eager and anxious to kickstart the much needed catch-up of care. But before we can do that, we really need to make sure our city is incredibly well vaccinated. This undertaking will have an immense impact, not just in terms of stemming the COVID offense, but in jumpstarting our ability to upend conventional ways of delivering care. With this in mind, I'd like to ask Dr. Skylar Neblett, Associate Lead of the Ancaster Family Health Organization, to kick off our discussion about COVID vaccination. Skylar, over to you.
Thank you, Dr. Packer. It has been a trying year. However, it has also been a year with hope as we have begun administering COVID-19 vaccines here in Hamilton. I have had the opportunity to participate in our local COVID-19 vaccine initiative, working at both the mass vaccine and mobile clinics we've had here in the city. As a family physician, in my practice, I get questions daily from patients who may have questions or concerns about COVID-19 vaccines currently available. Those who are hesitant in receiving a vaccine are often hesitant for different reasons. As a family physician and a physician participating in administering COVID-19 vaccines, I see my role as supporting patients with their vaccine readiness and vaccine acceptance. A common concern highlighted by patients is their concern about the risks with receiving a COVID-19 vaccine. A good example of this is the questions people have around the AstraZeneca vaccine. Should I take this vaccine? Should I wait for a different vaccine? Or even, should I have waited for a different vaccine if they've already received AstraZeneca? In my conversations with patients, this is how I try to put that risk in perspective. Although you may have hesitations regarding AstraZeneca because of the risk of a clot that has been associated with this vaccine, the risk of this clot is very, very low. Choosing to wait for an alternate vaccine also comes with its own risks too. Consequently, it is important that the decision to not receive the AstraZeneca vaccine is an informed decision being made. Currently, there's actually a greater risk of developing COVID-19 and a greater risk to yourself, your family, and your community in delaying or deferring receiving this vaccine than the very low risk of developing a clot associated with AstraZeneca. The best vaccine to receive really is the first vaccine offered to you to help protect yourself, your family, and your community from COVID-19. With more COVID cases in the city, I've also seen daily COVID cases in my practice increase as well. And with that also leads to the question from patients, do I still need to get a vaccine if I already had COVID-19? My advice is yes. We know that all currently approved COVID-19 vaccines are effective at reducing transmission of COVID-19 in our community. Additionally, we do not know how long natural immunity from COVID-19 lasts. Thank you, and now over to my colleague, Dr. Mehul Patel, who will be speaking about vaccine side effects.
Thank you, Dr. Neblett. I appreciate that. Happy Nurses Week, everyone. I've been blessed to work with and learn from such amazing nurses out there, so thank you for everything that you do. I'm Mehul Patel, a family doctor. I have a family practice in Stony Creek, and I work at a nursing home in Hamilton. I also sit on the board of directors for the Alzheimer's Society of Brant, Haldeman, Norfolk, and Hamilton Halton. Collectively, I have the honor of serving this amazing community that I live in. Putting what Dr. Neblett said into perspective, we have been getting many positive cases in our practice. What has been even more heartbreaking is that we're seeing more and more cases in our younger patients. The youngest patient I've had positive in my practice was a 3-month-old baby. So that tells you that anyone can get COVID. I have the opportunity to get my patients ready for vaccinations and answer any questions they may have regarding associated risks and benefits. My patients trust me, and I'm comfortable telling them, go get it. The benefits are far greater than the risk. The message that you have all been hearing from our well-educated public health officials is quite clear. The best vaccine is the one you get first. And all vaccines do what they were designed to do, which is prevent serious illness leading to hospitalizations or worse, death. And all vaccines that are approved by Health Canada will do that. Patients often ask me about side effects, and rightfully so. You should have a clear understanding of what goes in your body. After getting the vaccine, it's common to have side effects. This is your body's natural immune system kicking in and doing what it does best. Build immunity so when needed, you're ready to fight. Common side effects are pain at the injection site, headaches, fatigue, muscle aches, joint pain, fevers, and chills. But these are short-lived and your body should recover within 1 to 2 days. If not, then please notify your local public health agency or your primary care provider. Some people may experience more serious allergic reactions to the vaccine, but these are less likely and monitored by Health Canada. Please note that Health Canada will be monitoring long-term side effects as part of the clinical trials, and they are committed to being transparent. The more people that we get vaccinated, the faster we can reach herd immunity. Therefore, the faster we can get to our new normal and see our loved ones, hug them, and possibly enjoy the summer ahead. I want you to all know that although these vaccines should prevent you from getting really sick and avoid hospital admissions, it doesn't make you bulletproof. So please continue to do what you have already been doing. As one of your community members, we want to reach out to you and support you while you make this very important decision. If you have any questions, please see us. Talk to your family doctors, pharmacists, or healthcare providers. We are here to listen. We're here to answer your questions. And more importantly, we want to encourage you while you get vaccinated for yourself, for your loved ones, and for your community. It has been my honor joining you today. Thank you for having me. Now over to Dr. Vest, who will be speaking about long-term immunity. Mike?
All right, thanks, Mehul. Hello, everybody. My name is Mike West, and I'm a family doctor with a practice in Dundas. I also provide care to seniors in long-term care, both as a medical director and as a care provider. I've seen the benefit of COVID-19 vaccines firsthand, as our facility received vaccination of its residents earlier this year, and it has a profound impact on our residents and on our staff. Like many other long-term care facilities, we have had to endure COVID outbreaks, and I can tell you they are terrifying and an exhausting experience. But our team of doctors, nurses, PSWs, dietary and rec staff worked tirelessly to contain the outbreak and protect our vulnerable residents. We did this collaboratively and over Christmas when the vaccines were not yet available, but we got through it. And then we got our residents fully vaccinated. There was such a sense of relief, but also empowerment as we vaccinated the residents and offered them protection against COVID. Unfortunately, we had a second declared outbreak, but here there was so much less worry and fear for our residents, as we knew they were protected. ICU admits and deaths are just simply not a concern now for the fully vaccinated residents due to the effectiveness of these vaccines. And that's why I'm here today, to reinforce the importance of getting the vaccines and to share my optimism about returning to a normal life. We've seen firsthand how the vaccine has protected our seniors in long-term care from serious illness and death. And now they're slowly returning to things that they used to be familiar with prior to COVID. It may seem small, but recently our residents were able to return to the dining room without fear of contracting COVID. And that is how it can be in the community if enough people get vaccinated. We can return to some semblance of normal living and go out together, be together, and even hug one another. And getting the vaccine isn't just about protecting yourself, though. It's about protecting everyone in your community. And Hamilton is a caring community. I've seen this firsthand by the number of patients who tell me they've received the vaccine and the reasons why. They want to protect their parents, their grandparents, seniors, the vulnerable, and their friends. As a family doc, I'm here to answer questions about COVID vaccines. So please talk to your family doctor, someone you trust, and who knows you well. We'll try to meet you where you are, listen to your concerns, and provide you with the most up-to-date and accurate medical evidence. I'm optimistic and hopeful we can beat this virus, but it's only going to happen if we as a community continue to get fully vaccinated. So thank you to Mayor Eisenberger for inviting primary care to this media briefing, and now back to you.
Thank you very much, doctors, Dr. West and Patel and Nevlet, Packer. Thank you so much for what you're doing in our community, and certainly all of your patients and anyone else out there should take up the offer to call their doctor, have a good conversation about the value of the vaccine and what you might be putting into your body. I think those are very legitimate questions, and the doctors are all there to help you get through that process. So to all of our residents out there, I know this has been a very tough time. It's seemingly doesn't seem to get any easier, but I think we're seeing improvements. And I think, as Paul pointed out, hopefully by summer we'll have a better handle on what we can open and what we can't. But please do your part and stay home when you're eligible. Get the vaccine. Those are the best things you can do right now to get us to that better place. So vaccines are the most effective prevention tool. You've heard that from all the doctors today, to protect the health of not only yourself, but your community and your loved ones. And more eligibility is opening up, as Dr. Richardson pointed out. So it's vital that we all, including those that have already been vaccinated, to continue to follow the public health guidelines to reduce the spread of this virus in our community. The best community service you can do for your family, for your friends, your neighbors, is to get vaccinated when you're eligible. With that, and all the good words that we've heard from the great doctors, Jasmine, I'm sure there's going to be some questions. I'm going to turn it over to you, Jasmine, for leading us through those questions. Jasmine?
Great. Thank you, Mr. Mayor. We have 8 media joining us today. So as usual, we will have one question and one follow-up for everyone. In the interest of time today, I will ask all of our reporters, if you can, please address your questions to just one of our spokespeople. Our first question will go to Lisa Pulaski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. My question would be for Dr. Richardson about the outbreaks in the apartment buildings. We've now heard that there are 2 more that the city is dealing with. The residents at Rebecca Towers last week were calling for a vaccination clinic to prioritize those who are in the buildings and are kind of struggling with the outbreaks. Is the city looking at holding any sort of specific vaccine clinics for those buildings?
Thanks very much, Lisa. At this point, no, we're not looking at offering a vaccine clinic right at the building in this particular case. We are looking at helping people get to the vaccination clinics that are nearby. And so, for example, we were talking about the walk-in appointments over this past weekend. We've been making them aware of those, about booking in, and we're going to continue to look at that and look at whether there's any barriers in terms of people getting into those clinics. And so that'll be an ongoing effort in that way.
Okay, thanks. And then my second question would also be in terms of the outbreaks. The residents at Rebecca Towers were saying they took issue basically with public health's suggestion that socialization was the cause of the outbreak at that particular building. Just wondering if public health had looked at the other issues that they kind of were citing. You know, they've only had 1 working elevator in their building for months, and social distancing in an elevator, if you're in the high rise, is nearly impossible. Just wondering if those issues were also on public health's radar.
Thanks very much, Lisa. Yes, our investigators, when they look at them just on a case-by-case basis, even before an outbreak's detected, they do talk through with all of the cases, what are the factors that may have led to transmission in their particular instance. And we know a number of the cases, for example, in Rebecca Towers, are also clusters within households. And that, again, as I said earlier, that is definitely something that we do see, that there's a high risk if somebody in your household becomes sick, then going on to have another case within that household is a higher risk. As well, though, we do look in any kind of building such as that about where there are places that people might normally congregate. And so that includes hallways, elevators, that includes laundry rooms. So we look at making sure that people are aware of the requirements around physical distancing in those settings, aware of the requirements around masking in those settings, looking at cleaning schedules and working with the landlords to make sure that they're both cleaning regularly as well as using things that are effective. And as well, then we're looking at what happens around and outside those places. And so we do go through that very thorough investigation, both at the case level as well as the outbreak level, and look at what all those factors might be.
Thanks, Dr. Richardson. Our next question is to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions today. I'm kind of unsure who this question would be towards, but my question was about the outbreak at the gym, which both a staff member and a patron were infected. What more can, I guess maybe this is for Dr. Richardson, what more can public health tell us about this outbreak? Like, was the facility still operating despite the stay-at-home order? Or like, is there any other insight you can give us into this situation?
Thanks, Fallon. In terms of the gym, I don't have anything else specific at this point. We are working with our MLE colleagues into this particular instance and looking at what measures are necessary, but I don't have any specific details right now.
Okay, good. And my second question would be for Paul. Yeah, so gyms, this is again on the gym. So gyms are supposed to be closed under the stay-at-home order, but from my understanding, there is an exception in the legislation that does allow fitness facilities to open solely for the use by persons with disabilities, and they have to have notes which allow them to do physical therapy in a facility like a gym. Has Hamilton seen gyms taking up this avenue to remain open? Do you know if that was what was happening at Fresh Fit Athletic?
So what I do know is that I think some are doing that. I'm not going to comment on the Fresh Fit specifically, but some gyms are looking at that as an avenue of providing it. And again, the exception is there for a particular reason. We certainly would not want to take away any type of medical support that's required for individuals during the stay-at-home order, which has been significant in length. So there are requirements under that piece. It is not simply a loophole where you can say, well, this is all just general physical therapy. That's not what it's there for. General exercise would not meet that definition. And that's why you're seeing the investigation take place. And I want to be clear, there have been no charges laid at Fresh Fit. It is an ongoing investigation. I know it's of interest to folks, and so we are investigating to ensure that if places are open, because very few places can be open, when they are, they sort of stick out. And that's where we do a bit of an investigation. And if it's found to be properly open, then that life will be fine. But again, that exception is not to allow everybody to come and use a gymnasium. That's not what the exception is for. It's for specific purposes that would be under some kind of a medical need for the individuals. And in that case, we would fully support people being able to do their physiotherapy, but not so if this is a way of people being able to access the gym during the stay-at-home order.
Thanks, Paul. Next question is to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks very much for taking my question. I think it would be for Dr. Richardson, if you don't mind. I'm wondering if public health has directly asked management at the Rebecca Street Apartments to fix the elevator to better support physical distancing.
Thanks, Matt. So it's not really in our purview to direct building changes that might be necessary there. Indeed, we would say, that they need to have a limit in terms of how many people are on the elevator in order to maintain physical distancing. Clearly, fixing an elevator would give more capacity in terms of going up and down in terms of that, but it's not really in our purview to require that.
And I understand maybe it's not in your purview, but it would make logical sense to ask something like that. So I'm just wondering if there have been conversations between public health and the company regarding this issue that every resident is very vocal about.
Thanks, Matt. So absolutely, in the course of discussing things and noting what it is that's going on and what might help in terms of distancing, those things do come up through the course of that conversation.
Thank you.
Thanks, Dr. Richardson. Our next question is to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi, thank you so much for taking my questions. This one would be for Paul, I believe, that there would be improvements to the city COVID hotline, and I was just wondering if you had any updates on that.
So in terms of improvements, we have brought some more staff on board, and we'll continue to add a small number of staff. I mean, there's a limit to A, the staff we have, and B, the technology that's there. The real improvements come with time. As more people, as Dr. Richardson has said today, more people are eligible to use the online booking system. It is the single best and most efficient way for it to happen, and it can handle large volumes of people, as we've seen repeatedly, when the online booking system is able to have more people in it. So we expect that within the next 2.5 weeks or so, that will be basically all adults in our community, and we'll see what happens with some of the younger ages, but certainly all adults will be able through that, and that will allow our hotline to be there for people who do not have a health card, do not have access to the internet, or are not able to book online because of some very specific clinics and that public health are running throughout the city. That we will have plenty of capacity for. We can book in, more than 100 people per hour when we have the hotline going, but when it's filled with all sorts of other questions and all sorts of other issues coming, it does bog down. And basically the other challenge is when we have a huge crush of people trying to phone, the access to the queuing system, which will allow you to be on hold, is limited. So we expect that in the next couple of weeks, this will be down to a level where those who need to access the hotline can, and very pleased to hear that as we go along this week, starting tomorrow and starting on Thursday, that these bookings are through the provincial online booking tool, because the vast majority of people will be able to do it very quickly through that.
Thank you very much. And my follow-up question is for somebody from the primary care team, and hopefully you can decide who wants to answer. But there's been a couple questions about nursing and pregnant women, about vaccines, and ministry guidelines speak to like a lack of data on the impact of vaccines on these populations. So I'm wondering if you can just comment on that and what people should keep in mind.
Skylar, are you comfortable taking that question? If not, I can.
Absolutely. Thanks, Tammy. I can definitely take that question. I think from the data that we have right now, we do know that the risk of women who are pregnant or women who are even breastfeeding, the risk of COVID-19 is greater than the risk that may be associated with receiving the vaccine. So the recommendation from us from a primary care standpoint is that if these people are eligible to get the vaccine, then they should be receiving the vaccine right now.
Great, thank you. Next question will be to Tevia from the Hamilton Spectator. Tevia, you can go ahead.
Thanks very much. This is a question for Dr. Richardson. I understand how public health and your colleagues have explained how you could have an isolated case in an apartment building, and it may take clusters to try and determine whether there's this transmission between households and among close contacts before you can say, look, we've got an outbreak. I think I understand that part. However, I think that tenants, especially at Rebecca Towers, are saying, well, that may be the case, but what is preventing public health from telling us that, look, you have some cases in your building, and you know what, we're not asking for you to tell us which units are involved, but why can't you just tell us a little more generally that, heads up, there's some cases of COVID-19 in the building. We don't know yet the nature of its transmission, but you should know. Could you please address that?
Thanks, Tevia. Absolutely. As we're looking at cases across the community, I think there's sort of different levels at which we're notifying people about cases. We've been talking about COVID-19 across the community, that it is a concern in every part of the community, throughout this entire pandemic. And so I don't think there has, outside of an actual outbreak setting where we're concerned about some specific area and whether there might be some increased risk of transmission in that particular area. So you've heard us talk about positivity rates and where they're high. You've heard us talk about various factors over the course of this. And so we don't go looking at each building throughout the community to say exactly how many cases are the cases here. We're saying to everybody in our community that there are cases in our community, you need to be concerned. We talk about the case rates going up. We talk about the measures you need to take to protect yourself from the transmission of the infection. And so it's when we see something that is more significant in terms of clusters of cases and something that looks like there might be something different going on in a particular setting that people may not be aware of, that's where we notify people that we're concerned in doing more of an investigation related to their area.
I think my second question, I think I think when people read about Rebecca Towers, and now they're hearing about a couple of other places that you've identified, I think tenants are probably, freaking out, like, am I going to get this if I live in an apartment building? So there's the question of, I think, shared ventilation systems. For example, I think it's pretty common. We've all lived in, some of us who have lived in apartments, you smell cigarette smoke, you might smell cooking smells. And there are many older buildings in Hamilton. Our rental stock is older generally in Ontario. What are the risks, or what should people be thinking about airflow and about potential contaminated air from another unit getting into theirs? What level of risk should they be thinking about?
Thanks, Tevi. And, we've been looking at this now for a year, and we've seen other clusters that have happened in other buildings in Peel and in London. And so we get to learn from one another about what's going on and where we see these sorts of issues and what might be happening. And there's been nothing to suggest that that sort of airflow in an apartment building has played a significant factor in any of the outbreaks that we've been aware of and have been discussed. At this point, what really is clear in terms of what is risky in terms of transmission are the things that we've been talking about. The physical distancing measures are very, very important. And you've heard us talk many times about the hierarchy of controls. So how you can, what are the most effective things that you can do in order to limit the risk of transmission? And so those are the pieces about staying physically distanced. They are the pieces about posting maximum capacity signs on shared common spaces. They are the pieces about masking. And wearing masks if you aren't able to be physically distant when you're outside and all the time when you're inside. They are the pieces about staying home when you're sick and preventing transmission that way. They are about staying quarantined if you're a contact of a case and not going out and about in the community if you're a contact as well. So those are the most effective things. And by contrast, not doing those things are the things that put you at the highest risk.
Thank you.
Thanks, Dr. Richardson. Next question will be to Dan Takama from CBC Hamilton. Dan, you can go ahead.
Hi there. This is also for Dr. Richardson, and it's on the same subject. So the kind of explanation we got from public health around how the Rebecca Towers outbreak was noticed was that the people who were recording the cases noticed the same address coming up a lot of times, and that there wasn't necessarily a mechanism for tracking outbreaks in buildings. I can understand something like that would be complicated, but with these two new outbreaks being declared, I'm wondering if what happened at Rebecca Towers has sparked a change, if now there is, public health is taking a closer look at buildings and the possibility of outbreaks in buildings and the risks with them.
Thanks, Dan. Yes, anytime we see something a little different, we go back and look to see if how our methods are working for us and how they're helping us to identify things. And so we are going back over those and saying, how does this come up? What might happen? And we'll continue to work on that over the coming days.
Okay, and just on the same subject, I understand you're offering testing at buildings. I understand that happened at Rebecca Towers. Is that enough? Is there, I know residents at Rebecca Towers have been asking for a hotspot designation. Folks I talked to today said that there's vulnerable people living in these buildings, people for whom it might not be easy to get to a vaccination center, even if they do qualify. So isn't there more public health can do to protect these residents or people who are in situations where there are shared spaces? Sure, it's not a kitchen that they share with a family member who may be infected, but they are sharing spaces like elevators, hallways, lobbies, things like that.
Thanks very much, Dan. I think, it's really important to remember that we have these kinds of spaces in all sorts of places all through the city, and apartment buildings and similar sorts of workplaces that people do have to go out to. And the most effective measures, again, in terms of limiting spread are the ones, again, about, maintaining distancing, masking, staying home if sick, not visiting with people from outside of your own household. All of those are tried and true, and they really make the biggest difference. Absolutely, there are some vulnerable populations for whom, it might be more challenging in terms of reaching vaccine clinics and those sorts of things. That's why we do have the extended hours and operate 7 days a week, and do have a number of sites that people can go to. We're also with this group looking at access and have provided access through the walk-in clinic on the weekend so that people don't need to make an appointment if that's difficult for them. And we're looking at other ways that we can break down barriers for people to get access to vaccine.
Thanks, Dr. Richardson. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My question is for Paul. Can you tell us a bit more about this school that was found to still be open? Like, how long has it been operating while the other schools were shut down? You know, was it operating full-time, like full-time classes? And how did you find out about it? Like, how is it flowing under the radar for so long?
So I'll have to get back to you with some of the timing details. My understanding is that some elements of it were open, and how these things come through, we'll have to get those details to you. But two things occurred. One is obviously we saw that it was open and not the proper documentation in place, and so both there were both charges laid to an individual as well as to the entity itself for not having that documentation and being open. But Joanna, we'll cycle back to you. I'll get MLE to give you some of those key details around dates. And just because we became aware of it out of date may mean it had been opened, but I'm not sure how far back. We'll investigate how long it was open, but we'll get you some of those key details. And it's just, again, a reminder that if you're not operating within, there are some exceptions which allow people to open. And all we're asking is that people follow those correctly. And there is the ability for schools in certain cases to be designated to be open, and all of that can work. But in this case, they couldn't provide any documentation to suggest that they could be open. And just because you're a private entity, rather than on the public school boards, it's all treated the same way. They are under the umbrella of the Ministry of Education, so they needed to follow the rules in this case. And we'll get you the more details as a follow-up, Joanna.
Thanks so much. And my second question is for Dr. Richardson, again, back on the Rebecca Towers. Can you talk about the risk that people in apartment buildings face when it comes to the shared spaces, such as the elevators or the hallways, or what is, you know, other than wearing a mask, like what exactly are they supposed to do to avoid that, like particularly in elevators and things like that?
Yeah, thanks, Joanna. I think, you know, we do, as I said, have lots of people who are living in those sorts of situations across our city. And so the kinds of things, again, are back to those key, consistent public health measures piece around physical distancing, around wearing a mask if you're in those sorts of situations. Elevators, you'll see elevators all throughout the city have limits in terms of how many people can be in them in order to maintain that physical distancing while we are in them, that those shared spaces have a maximum capacity. So something like a laundry room should have a maximum capacity posted in terms of how many people should be in at any one period in time. Very much, again, you know, encouraging hand washing and those sorts of things, as well as the kind of cleaning that happens that we ask for places to do throughout the building. But the most important and most impactful ones are about the distancing and the mask wearing.
Thanks, Dr. Richardson. Our next question is to Samantha Craigs from CBC Hamilton. Samantha, you can go ahead.
Thank you. I would love to hear from any of the primary care physicians, but I suppose in the interest of time, I will direct this to Dr. Packer. I was wondering if frontline physicians are doing anything in particular to prepare for any presentation of blood clots.
Yeah, Samantha, thanks. That's an excellent question. We are very fortunate to have some of the leaders at the Ontario Science Advisory Table as local hematologists. So we've had very active educational reach out to ensure that we are all aware, as are the practitioners in the emergency room, of the presenting potential symptom complex, the timeline at which we could anticipate this, the questions that we should be aware of. And I think we can safely say that we have this very well covered with provincial leadership living locally.
Samantha, you can go ahead with your follow-up if you'd like.
Sorry, I had just had an internet issue at the exact wrong time. Pardon me. This is also for Dr. Packer. I was wondering, in terms of primary care physicians, what sort of symptoms you might be seeing in patients who have recovered from COVID?
Excellent question as well. I wish we could say that we've seen a wealth of folks who have recovered from COVID. It's sort of a bittersweet lining. The truth of the matter is that for the first two waves of COVID, the data here replicates what we saw across the country, which is a very, very small percentage of folks who were diagnosed with COVID ever needed to seek care. And it was disproportionately those in long-term care, and that was a very different story. So we are only now beginning to see folks who've been sufficiently ill to seek care, not require hospitalization, but see us. The vast majority of younger folks do get well and get well relatively quickly. And there are some very positive stories that have been very dramatic in the last few weeks, where young folks have been tremendously ill and are now up and about and caring for their young ones to whom they've given birth while affected with COVID. There will be, and I think this may be what you're getting at, a group of individuals who will evolve and develop something called long COVID. And we are working together as a community with both Hamilton Health Sciences and St. Joe's to address comprehensive programs to fully serve those folks as we come to better understand what that trajectory may look like.
Thank you.
And I'll just open that last question to our three other family health doctors, if anyone else wants to jump in on that.
Thank you. I'm glad you did that.
No, okay. Okay then, Mr. Mayor, that's the end of our media questions for today. We'll pass things back to you.
Great, thank you, Jasmine, and thank you to Bill Custers and the entire team at Cable 14 and Clear Cable. And thank you again to our media partners who join us every week, who help ensure important information is shared with our community, as was done today by the family docs that shared, I think, a lot of lived experience and a lot of their experiences out in the broader community in terms of COVID. So thank you very much for your participation today. And please, folks out there, do your part. Stay home while we are under the stay-at-home order. Connect with your loved ones virtually or on a video chat or over the phone. Check on your neighbors, especially elderly neighbors, to make sure they're doing okay and have everything they need. And please shop local as much as possible, given that we're still largely closed in terms of a lot of the shops and restaurants. The Hometown Hub is still very much operating, so hometownhub.ca to connect with and support our amazing business community locally. Please shop local as much as you can. And as always, for more information on COVID-19, financial supports, and any updates, visit our website at hamilton.ca/coronavirus. So please continue to follow all public health measures. They work, help stop the spread of this virus. And we're going to see you next time at our media briefing on Monday, May the 17th. Thank you for joining us and stay well.